Pet Surgeons.
Here in Cork, there's a state-of-the-art animal practice with a very special team of vets.
These are directly close to the spinal cord, and if we push too far, it's danger.
Every day, clients come from all over Ireland.
No kissing. It's a first date.
For the most advanced veterinary and nursing care.
Basically, this is a bite wound, which you would manage the same, be it dog or cat.
This is the story of Gillaby Veterinary Hospital. Its staff and its patients. From beloved family pets to exotic wildlife. From cats and dogs to parrots and cheetahs. You never know who or what will come through the door next. Gillaby is one of Ireland's leading animal hospitals. Here at Toker, south of Cork City, a team of highly experienced vets and nurses treat patients from all over Ireland.
Gillaby Veterinary Hospital here speaking. Ah yes, it is great here, just like a hotel.
Gillaby's core team includes 10 vets, each with their own special set of skills.
I see myself as the person that's the dreamer of the practice. You know, not the person that worries about the money. You know, that's the other guys.
My two main roles would be to do with Photo Wildlife Park and guide dogs. And then after that, it's basically whatever comes.
My area of expertise is ophthalmology, which is eyes, from the inside to the outside and all the way around.
I'm jack of all trades. I do everything. I suppose my overriding thing is I love consulting, but I love surgery.
Supporting the vets in their work is a dedicated team of veterinary nurses.
We depend on the nurses. They are the backbone of us really, and they support us every day.
Life in Gillaby is very busy, really busy practice, you know, lots of different patients in.
When you're on the kind of shifts, you're kind of looking after the everyday needs of the patients, like walking them, medicating them, making sure they're comfortable.
You're looking after all the emergencies,
even from blood sampling,
bloods and x-rays, and yeah, there's just a huge variety of work that we'd be doing.
Yeah.
Gillaby was a small place. We started in a small terrace building. There were 3 vets, 1 nurse, 1 receptionist.
Being a referral clinic, we do get calls from vets, from clients, and people come from near and far.
It's 30 people now, and you know, we've 10 vets. My God, 10 vets. You know, look how far it's come in a short time. It's currently a great place to be. I love working here.
Vet Shane's first patient this morning is a young pup, whose anxious owner Catherine has travelled down from Meath. Noodle has a neck injury, caused by a collision with his sister, Doodle.
I've Noodle, a little Japanese chin, and he's 3 months old, nearly almost 4 months, and he was having fun with his sister, and 2 of them went head on and banged, and a couple of days later he started limping a little bit, so I took him to the vet. They x-rayed him and he damaged his neck, so they recommended he come down here. So, oh, he's a lovely little boy, you know, and even when he's not well, he's still positive and loves fun, and it's desperate restricting him now because he's a really little runabout boy.
Come on. Thanks for travelling, Catherine.
Thank you.
At that age, you're thinking that it's something that this puppy was born with, potentially. But you've got to go through a series of steps, and the simple thing we'll do is we'll walk them, and we'll see what their walk is like. Is it a broken leg? Is it a little strain somewhere, pain somewhere? Or is it, in fact, a little spine injury?
You're not sure about me? Yeah. Oh, that's lovely.
We put them on the table and we start more closely examining them. So I got to go through a process of trying to find out, is this a spinal issue as opposed to an orthopedic or a joint injury?
I'm going to take his paw, and I'm going to turn his paw upside down.
Okay.
Now, again, that large fibre on his spinal cord should work, and tell him that paw is in the wrong place and correct it.
Right.
A little bit delayed, see that?
Yes,
Okay, he shouldn't do that. So I'm going to check his back legs. Seems to be right side, right front, right back. Or it would seem to be slightly worse than the other side. Okay, so we have some evidence to suggest that there is some pinching of his spinal cord.
And then I go through a series of tests where I'm looking for nerve reflexes, and potentially these can be damaged. It's a standard procedure we're working through.
I'm going to do a couple of simple little tests now on his face, which will give me an indication that a section of his brain is working normally. So I'm going to tap your eye, nice blink. Good boy. And this is picking up a little nerve, the 5th nerve, and then the 7th nerve gives me the blink, so that's very good. That's 2. I'm checking 2 different nerves. Hey, it's okay. That's okay. That's okay. That's okay. So what I would be suggesting is that we give him a little anaesthetic.
Right.
We x-ray him.
Right.
I don't think you need to do an MRI scan. We may be able to tell enough.
Right.
If we don't see enough, we have the MRI. We just get a little bit more detail.
Right.
I think there's an injury, a spinal injury, probably what we call a fracture luxation, so where 2 vertebrae are together. I suspect there's a slight shift and dislocation of the neck, a fractured neck, or if you want to be frightening about it, he's broken his neck.
Very cute, like a little teddy, isn't he? Very cute.
if you leave this dog, potentially anything, any bump can potentially cause this to happen again, and potentially we could have a catastrophic displacement and paralyze this dog, and in fact it could potentially kill the dog. That much initially, can we have a look at that, and then we start cooling down subsequent to that. So let me see the first one.
When it comes to treating their own animals, even the most experienced vets can get a bit squeamish. Today, vet Catherine's golden retriever Sadie will be neutered by her colleague Tom.
Vets with their own pets, you will either have everything to do with them and you won't let anyone else anywhere near them, or you don't want anything to do with them whatsoever. And I definitely fall into the latter category. So this is Sadie, so she's over here and she's having her spay today. So I might be a little bit on edge today. But yeah, I've been told that I am not allowed anywhere near him or her while we're doing it.
It's grand to work with another vet's pet when that vet is not in the room beside you. When the vet is in the room beside you, then you know that they know what can go wrong, and that's putting lots of extra pressure on you.
It is a little keyhole surgery, so she'll have 2 tiny little incisions back here, and she's going to have an ovariectomy, which is where both of the ovaries are removed, so she won't be able to have any seasons and she won't be having any babies.
So I know taking lots of hair off her.
Yes, I do. Yeah,
okay, that's fine.
Yeah.
Because I was warned the day, the client in the other day, and I was not allowed, and even when she saw me, she did clip off, she gave up.
Oh no, so, that's fine.
One last thing, you are not going to be here when I'm doing her.
I won't be in the room.
That's fine. Pressure off then.
The idea of them being upset or sore or hurt in any way, it would really bother me, so I prefer to just give her to somebody who I know will look after her and then take her back at the end of it. That's definitely what I prefer to do.
Come here, dirty dog. You left out some meat. Sorry, I think you're outside the whole time. You miserable dog.
Oh dear.
There we go.
I actually can't see teaching now, which is probably a good thing.
While Sadie is prepped for surgery, Nurse Mairead brings Noodle the pup in for his x-ray.
And so we x-rayed him and looked at his x-rays, and initially we were pretty happy that there was some displacement that shouldn't be there. That looks to me like it's the articulation between C1 and 2 there. But we still had a suspicion, so the next step for us was to do an MRI scan, and we had the MRI truck parked outside. It comes once a month from the UK, and so that gives us really accurate imaging of the spine. And with the MRI scan, we got really good detail, and we could see that there was, in fact, an instability between the first and the second neck vertebrae. Something is squeezing his cord, which is what we thought. It confirms for us that he's got cord compression.
It's been a horrible week, really, knowing that just seeing him and his balance going and knowing there was something wrong. It's the waiting, really. Waiting around, waiting.
Shane has sent Noodle home with instructions for Catherine to keep his movements restricted until his surgery next week.
No medications necessary at the moment.
Right, yes.
Or just a cage confinement.
All right then, we'll go home, and thanks very much for looking after him. It's a weight off my mind.
In Theatre 2, Vet Tom and his team have started work on Sadie's procedure.
Neutering a dog is all about taking away its reproductive parts, okay? So, in neutering females, we're generally looking at removing the ovary plus or minus the uterus. Historically, and what a lot of vets still do, is actually remove both the ovary and the uterus. But now, just with doing a lap spay, and you can see we just have 2 tiny little holes just wide enough to get in the equipment. And so we're just removing the ovary. Certainly these dogs seem to recover much faster. The procedure seems to be a little bit longer, but the dogs certainly recover much faster. Okay, so they're all separated. There's absolutely no bleeding.
In the end, the ovariectomy takes us 30 minutes. All that remains is for Vet Tom to place 2 small sutures and wake Sadie, at which point Catherine can finally relax.
So there's our ovary.
It's quite nerve-wracking. I mean, she's going to be fine. I've done so many spays myself, and the odds of a complication or something happening are really slim.
I was joking earlier on about her dog being fat, but there's a lot of glistening fat here around the ovary, so she's not as skinny as she was making her out to be.
Oh, little ovaries.
The ovaries, my backside. I've been with the fat that's
on me. But she's still your baby, and it's still your baby that's on the table in this, so it's quite nerve-wracking. So I haven't got any work done for the past 2 hours, but I'll start getting something done now shortly.
Go away, Catherine. Go away. No, go out. Leave. I don't want to see it. I couldn't even catch the edge of the skin right there.
Sadie will spend the afternoon in recovery before returning home with a very relieved Catherine. Noodle the pup and his owner Catherine are back home in Dunboyne, a house that's something of a shrine to the Japanese gin.
Well, they're a lovely small little breed. They used to fit in the sleeves of the kimonos, of the geishas, and they had some very small ones as well. They put them in bird cages on the walls, but they're a very attractive little breed, black and white, red and white, sable and lemon and white. These were for best in shows. We won down through the years with the gins at the club shows. And this, of course, was this year, where Noodle's aunt won Best Breed of Crufts. Doodle, she'll be starting in 6 weeks' time. There's a chin specialist coming over from England, and it'll be her first show, 5.5 months. So Noodle now, we'll just have to put everything on hold at the minute. He was meant to be at that show with her. I was going to be showing the two of them, the two babies, and but now it's on hold. We'll have to wait and see. They've been together since they were born. They were 4 months yesterday, and they're missing each other, and they want to play, and it's awful keeping them apart, but it just has to be. You won't be able to keep up with her now. Come on. She keeps going over to his cage to say hello and kind of come out and play, and he can't come out and play, so it's lonely for her as well. We think about him all the time, but she's lonesome without him. I wouldn't mind the surgery, if I thought he was just going to give him a good quality of life and that he'd be back to his old self. To be marvellous, but we must be realistic as well. You couldn't resist that little face. Handsome dude. Yes. Oh, he's a great little trooper. He's a real little trooper, If he can do it at all, he will. He's a very determined little boy, aren't you? It would be lovely if he came back to the way he was. He was a bonny little lad, yeah.
In 3 days' time, Catherine will take Noodle back to Gill Abbey for his surgery. After a week cooped up at home, Noodle the Japanese gin pup is back at Gill Abbey with nervous owner Catherine for surgery with vet Shane.
If he was an adult, I wouldn't feel so bad, but he's so vulnerable. It's such a little thing. I doubt he'll be coming home today, but we'll have to see how long it'll be.
This is Noodle. So, all creatures great and small, all cases big and small. The surgery case we don't do that often. We know we're dealing with a tiny, tiny little dog, very small bones. Potentially at any stage this dog's spinal cord could snap and we could lose this little puppy. So we have to do something. We can't leave the dog the way he is. Hi. Thanks for waiting for me.
That's all right.
The idea is that we're going to put 2 little screws in around his spine and try and stabilise the 2 vertebrae. Right. So we provide an internal splint. Right. And that internal splint will stay potentially forever. Mm-hmm. And help to support his neck. Mm-hmm. If all goes well and he recovers well from the surgery, then I'll keep him for a couple of days.
Right.
I'll keep him until I'm happy that he's up and stable and moving.
Right.
All right?
Okay. It's a difficult operation, so we won't know till it's over, but I'm so glad and we're not waiting around any longer, just for him, because he was nearly house trained and now he's gone back and it upsets him, being in the cage and that kind of thing, so I'm glad it's finished today, one way or the other.
This little guy is so small and he's so young. His bone is soft, but so small. And I'm doing the dissection, getting in there. We're shifting some really important nerves. And my concern is that one of those nerves is very influential for his respiratory system, his ability to breathe during the anaesthetic. And if we overstretch that, he could stop breathing in the middle of the surgery. So we lose him.
It's tense atmosphere because you know that it's potentially a big surgery. Things can go wrong. Tom will often scrub in for some of the more complex surgeries, and it's basically because Shane will want a second pair of eyes, so he'll want an experienced surgeon to help him.
Familiarity with any surgery really is the most important thing for us. That's familiarity of all the structures, and it's just constant repetition makes us good at a lot of surgeries. But when we're doing one of these every 2 years, it is a big deal.
I just trust him, and he can see what I'm doing, and he's concentrating all the way through. So. When I'm lining up a pin and I've only got a couple of millimetres to play with, he's the guy I want on my wing. So we're ready to start. So midline approach.
If the surgery wasn't to work or something like that, I can't even think about that at the moment. We'll just pray that something can be done for him, and we'll face the rest when that will come. Mm-hmm.
The objective is to identify the first and the second vertebrae, and we feel that there's an instability there. And so what we're going to try and do is correct the alignment and stabilize it. So the tricky part of this is the approach, which I think we've successfully negotiated. We've got in here now. Little Noodle is nice and comfortable. So we're going to now just very gently over the next 20 minutes lift the tissue off the 2 bones so that we can start identifying the little parts we looked at earlier on the little plastic bones.
The thought of him having to be operated on and plates and thousands of questions come into your head, you want somebody to tell you it's going to be all right.
Vet Shane will be inserting 6 tiny pins into a 2 square centimetre section of Noodle's spine. Each one must be aligned with microscopic precision to ensure a successful outcome.
His heart rate is the biggest thing, so I'm looking to see if his heart rate is continuously dropping. So if his heart rate is continually drops, basically it could mean that he's just getting into trouble, and his respiration rate then will follow. They go hand in hand with each other. But you're literally honest on the patient. You're like basically checking it continuously.
We're putting these pins in now. We have the first 2 in. We have the third one. And so putting these ones in now, these are going on feel, and these are going to hold the thing together for us.
Biggest fear is that we drive a pin into the wrong place, and if we drive that pin into the wrong place, it is going to do one of 2 things. Either one, we're going to cause immediate death, or even worse, that we're going to drive the pin into the spinal cord and cause respiratory distress and respiratory arrest.
If he became paralysed or something like that, I just don't want to go down that route yet.
These are directly close to the spinal cord, so I'm working over the top of the spinal cord, and if we push too far, it's danger.
With all 6 pins in place, Shane now fuses the vertebrae with a cement compound to keep Noodle's tiny vertebrae secure and aligned.
Great. Yeah, so it's a huge relief, because that's that's technically a demanding surgery, and pin placements are good. Technically everything went as we wanted, no surprises, no anaesthetic complications, no bleeding complications, so really happy.
He was just amazing, our surgery, in that we took him down to x-ray to check that alignment was okay, and he literally woke up like that, and all he started doing was wagging his tail. So little Noodle is only 15 minutes recovering now, and you see he's wide awake, which is a huge relief to all of us, and he's even wagging his little tail. He's been given some pain relief now, and later then we're going to give him some food, because he's only a little puppy, so we're going to try and get him to eat later on tonight.
Noodle spent the next 12 hours with Nurse Mairead. When she left work, she brought her tiny patient home with her.
So he was really good. We took him home, just kept him really warm, and gave him some food. So we sat at home and watched TV for the night. He was a little bit flat, maybe about 10 o'clock, so his blood glucose dropped. So we just checked that, and then we gave him some glucogel, and then we fed him every 2 hours then throughout the night.
I'm very satisfied for him. Cute little puppy, and a lovely owner, and sometimes you make these decisions as to, do we do surgery, to take a serious risk with surgery?
Just seen him, coming in when Mairead brought him in, and he wagging his tail, and it was beautiful to see. Oh, Mairead, that's brilliant. This is amazing. Like, the tension that was there yesterday, the worry that we had that we would make things worse, and we've made things better, so wow. Let's want to put a smile on our face now for the rest of the weekend, so that's excellent. Get in trouble.
Good boy. You're a good boy, aren't you?
Sorry, all done? Yeah, she has to come back in the morning again. No bother. I'll just go there tomorrow. Yeah. What's she coming in tomorrow? More medicine. More drugs, yeah.
Fully recovered and ready to return to Dunboyne, Noodle is about to be reunited with his owner, Catherine.
Oh, I'm dying to see him. Absolutely. It's been an awful long 6 days today, since he was admitted. So, an awful long weekend. I wonder will he have forgotten me in 6 days, because he gets such care, and the girls took him home at night as well, to say, rather than have him here on his own. He might want to come home. He was so spoiled here.
That I would have loved to have kept them. I never knew that there was a breed like a Japanese chin, so when after minding him for a couple of days, I was Googling it and looking it up, kind of going, what can I know more about them? No, here's your baby.
It's wonderful.
You're afraid to touch him.
I am. I never thought coming down that I really didn't think that he would, that he'd make it. Oh, a huge surprise, because even though they said he was that he was moving, and that until you see it yourself, and how good and the way he was able to stand up and not fall over, and
I get very attached to them. I'm a sucker for the small little ones. I really like them. I like pugs and I like small little puppies and stuff. He's just so sweet, isn't he?
Yes,
loves affection. Yeah, he's a pleasure to mind.
Yes, he's a lovely
boy. Happy out with them.
And quiet. Are we done? Is it empty? Yeah.
Did your doggy wake up? Well, that's a good question. If you give me one moment, I'll find out for you now.
It's not that I don't like birds, but I don't like the way they can go at your face.
Are we going to get them in? to the surgery.
In the normal healthy dog, this voice box should be nice and wide. So now he's trying to breathe through this tiny airway. Well, he was always a fighter. All right, Frankie?
Had we taken another couple of hours, he was going to be dead.
Fosle tachtennacht RT1 fechen an sagart Iasonach Peter McVery sheer chacharcha bliana durge. Draw chud share san Kiarte an Dulach Augustina Gandiden. A view from the basement is at 10:15. That's after prime time asks if the country can afford a return to benchmarking at 9:35. Next up, it's the main evening news.